Canavan disease is a rare inherited autosomal recessive neurodegenerative disorder caused by inactivation of the enzyme aspartosylase due to mutations. This disease is caused by an inherited genetic abnormality due to the lack of an enzyme causing deterioration of the white matter called myelin in the brain, thereby preventing the proper transmission of nerve signals. This disease is one of a group of genetic disorders called leukodystrophies. Leukodystrophies disrupt the growth or maintenance of the myelin sheath, which is the covering that protects nerves and promotes the efficient transmission of nerve impulses. Canavan disease results in a spongiform degeneration of the brain and severe psychomotor retardation. Spongiform leukodystrophy, as oligodendrocyte myelin sheaths are disconstructed by splitting at their ECF intraperiod lines, with formation of intraperiod vacuolization. The pathogenesis of Canavan disease remains a matter of inquiry. Now, some of the most common symptoms are that they are larger than normal head circumference, there is poor head and neck control, there's a reduced visual responsiveness and tracking, unusual muscle tone leading to stiffness or flappiness, unusual posture with legs often kept straight and arms flexed, difficulty eating with food sometimes flowing up into the nose, difficulty sleeping, and sometimes even seizures. The causation of Canavan disease are the mutations in the ASPA gene. The ASPA gene provides instructions for making an enzyme called aspartosylase. This enzyme normally breaks down a compound called N-acetyl-L-aspartic, also called NAA, which was predominantly found in nerve cells in the brain. The precise function of NAA is still unclear. At one point, NAA was thought to have a role in the production of the myelin sheath, but now it seems that this enzyme may be involved in the transport of water molecules out of neurons. With the NAA gene, how it affects Canavan disease is that there is an inborn error in the catabolic metabolism of NAA that results in a lack of amido hydrolase 2 activity in oligodendrocytes. The risk factors mentioned for Canavan disease in various sources include the Eastern European Jewish ancestry. The risk factors for Canavan disease are factors that do not seem to be a direct cause of the disease, but seem to be associated in some kind of way. Having a risk factor for Canavan disease makes the chances of getting a condition higher, but does not always lead to Canavan disease. But the absence of any risk factors or having a protective factor does not necessarily guard you against getting Canavan disease. The demographics of this disease predominantly begins in infancy. This disorder usually becomes apparent between 3 and 6 months of age and unfortunately progresses rapidly. Anyone can be a carrier of Canavan disease but may not have any symptoms. When both parents are carriers, each child has a 25% chance of having the disease. The carrier rate for the general population is 1 out of 300, while Ashkenazi Jews are at a high risk with a carrier rate of 1 out of 55. Most people who have this disease die in childhood, although some survive into their teens or early 20s. Life expectancy is reduced with average survival until 10 years and occasionally longer, like I mentioned before. In cases of mild Canavan disease, life expectancy is usually normal and the prognosis is good. There are some studies where the demographics show that the Jewish cases could be traced to a particular area of Eastern Europe called Vilna. The mortality rates show that there's an average death when infants are 18 months. If both parents are of Ashkenazi Jewish descent, the incidence rate is 1 in 6,400 to 1 in 13,500 births. This ratio shows that there is one carrier in every 40 to 58 Ashkenazi Jew. For the non-Jewish population, the incidence rate of severe Canavan disease is approximately 1 in 100,000 births. The prevalence of Canavan disease in the general population is unknown, but most reported individuals are of Ashkenazi Jewish origin. There is a current significant research that has the opportunity to affect this health condition. There have been investigational therapies such as stem cell therapy, drug therapy, and gene therapy being used as treatment to children with Canavan disease. Between the three therapies, gene therapy and drug therapy are being researched the most. Looking through Canavan disease research, stem cell therapy is still fairly new in regard to this disease, and so far, they are only testing the benefits of human neural stem cell therapy. With drug therapy, Dr. Leone and collaborators discovered the neurologic benefit of lithium citrate administration in Canavan patients, which is currently one treatment option to help preserve brain function in newly diagnosed Canavan. Building upon this success, her collaborator, Dr. Jansen at the University of Illinois, is developing new cell-based drug screening assays, which hopefully will lead to more pharmaceutical options for the disease and related conditions. Gene therapy seems to be one of the most popular therapies being researched for this disease. Dr. Leone's group was among the first to propose a metabolic understanding of the disease and AA as the main compound that is abnormally elevated in Canavan disease. Metabolic deficit is a central feature of Canavan disease that underlies hypomyelination and cell loss. It was also discovered that dietary therapy that fuels brain metabolism resulted in neurologic improvement and myelination in a well-characterized animal model on Canavan disease. This work is leading to a better understanding of complex brain metabolism, with direct applications to Canavan disease as well as a broader significance for other brain diseases, including Alzheimer's and brain cancer.
There are no treatments and there is no cure.
We have identified many other mutations to help pediatricians and neurologists all over the world with the diagnosis of this disease. Now that we're able to diagnose patients earlier and earlier, we can help as much as we can with the prescription of these drugs.